Professor, thank you very much for your time. Okay, talk to us about what you know around the timelines. Are you able to give us an indication of how quickly the Johnson & Johnson vaccine is actually going to arrive and be rolled out?
So I'll take you through the process. So on the 29th of January, we heard that the J&J vaccine, a single-shot vaccine administered once, was effective in helping avert hospitalization and death. And after that, we began to work about how one would realize the rollout of this vaccine in South Africa. We already know that J&J have submitted their application for registration, and it's been a rolling submission. And last week, J&J submitted its emergency use authorization to the FDA for use in the USA, and will continue to apply for registration throughout the world, including South Africa. So there is a hiatus, a period of time where we wait for the registration, the full registration of the vaccine in South Africa. And so we have an opportunity to roll out the vaccine once we know that it's effective. And so this is what we'll be doing in the next couple of weeks until there's registration in the full registration in the country for the J&J study. So to be able to do this, we have to have regulatory oversight. So SAHPRA has to approve the authorization of the use of the vaccine in this country, and we also need to import it. So the moment we have the green light from SAHPRA, which we expect very soon, we'll be able to trigger the cargo to be flown in from Belgium into South Africa. And so the moment the permits are there, that obviously triggers a whole cascade, because we have to fly the vaccines in under good conditions. They have to be well managed. They have to be good cold chain, and we have to manage the process very carefully, because we don't want these precious vaccines to have their cold chain altered in any way. So it's very important that we control the flights into South Africa and make sure that everything is safe, so that the healthcare workers can get their vaccine. Sure. And we know that it's been viable.
Let me take you back to the authorization issue. You just explained that in the USA, the FDA, there's been an application from Johnson & Johnson for emergency use authorization, and also here in South Africa with the Health Products Regulatory Authority. Will our local regulatory authority wait for the FDA, or is it very likely that we could approve it before the FDA does?
So the SAHPRA are looking at the submission, and as we said, it's a rolling submission, and so they will also concur with the other regulators and have bilateral discussions. And so while this is all happening, we do seek authority from SAHPRA to evaluate further this vaccine in our country. So we will be administering the vaccine under authorization of SAHPRA while we wait for the full registration of the product in South Africa. It could be that SAHPRA evaluates it faster, but the process is that usually the FDA goes ahead of the other regulators, and then there are bilateral discussions and support in other regions for these approvals. So we are applying. So the FDA is going to be giving emergency use authorization, and this triggers a whole lot of processes at the regional level in South Africa and also in Europe.
All right, so you are President and CEO of the Medical Research Council here in South Africa. You've also the joint lead investigator on Johnson & Johnson, so you know this vaccine. It's completely in your area of observation. What can you tell us? I mean, we know that it's proving really effective against the variant here in South Africa, but what else can you tell us about it? For example, is it safe for children?
So that has been evaluated at the moment. So the first thing you do is you establish safety in adults. And once you establish safety in adults, you trigger a whole lot of processes to get information in other age groups and other populations. And so there'll be evaluations in pregnant women, and there'll be evaluations in children as a bridging down. So you start with older children, and then you go down to young children. So you establish a whole bridging immunogenicity so that you can evaluate the safety and look at correlates of protection so that you can confer what you saw in adults, you can see in children. So that is a whole process, and the studies as we are underway as we speak. And so the J&J and the regulators will glean a lot of advice and a lot of scientific evidence on their use in other populations, which is incredibly important because we want to be able to give it to pregnant women and we want to be able to give it to children.
I'd like to get your opinion on AstraZeneca, and this, of course, is in your role as head of the Medical Research Council. We know that it hasn't proven effective in stopping, just in a study of 2,000 young people, moderate, mild infection. I was speaking to the Health Ombudsman a little earlier. He said then it is very obvious that it will not help combat the variant in terms of severe illness and hospitalization. Is he right, or is there a possibility that further studies into AstraZeneca could actually show that it might be useful even against our variant?
Well, we have to have the evidence and we have to accumulate the evidence. And there is a big phase 3 trial happening in the United States of America. There's a 30,000 study that's ongoing and fully enrolled, and we need to see the data from that. But that won't tell us how this vaccine works in our variant, with our variant. And so we will also have to evaluate further and have other discussions about how we carefully, if we go ahead with the AstraZeneca program, we have to evaluate how we carefully go ahead and how we evaluate the impact of this vaccine in the elderly or people with comorbidities or people to try and see whether this has an impact on severe disease and hospitalization. So any planned use of AZ in South Africa will need to have good evaluation so that we can draw proper conclusions about its utility for moderate to severe disease.
Hence the pause. I want to just ask for a comment, if I may. The World Health Organization has just recommended, and I'm getting this from our London correspondent, that the AstraZeneca jab can be used in countries where, quote, variants are present. That endorsement for the WHO seems to almost go against our decision to pause rolling out AstraZeneca. So does that suggest we should have gone ahead anyway?
Well, I think we have to look at our local evidence. And so when you make global pronouncements, you take into account the global situation and you make a 30,000-foot decision. And we in South Africa have to make a decision on the ground. And we need to make sure that whatever we advance into our healthcare workers, we know that there will be a measure of success. And until we do that, it would not be a good idea to advance a vaccine that we had no idea worked in serious disease. And so it's important to do that. And we also have to advance vaccines that we have evidence it works in our region. And so, the healthcare workers of South Africa have had a very hard time. They've worked very hard and they've they've sacrificed and they've lost family members and friends and colleagues, and they themselves have been hospitalized and have died. And so it's our job to provide them with the best evidence vaccine to make sure that they can continue to do their job. And while we're trying to accumulate the data on AstraZeneca, we need to look and see what other vaccines are available so that we can use this to support their work in the health system.
Professor Gray, you have explained the things that still need to happen before the Johnson & Johnson vaccine is rolled out. But I'm going to ask you for your best educated guess on how long it's still going to be. Are we going to be waiting days or weeks, do you think?
I think it's going to be, it's not going to be weeks. It's going to be days. But days, not more than a week, but not weeks. So we hope to have this vaccine. We're trying our best, and we're working day and night. We have a group of investigators, a very dedicated team. The National Department of Health and their team, their vaccine rollout team, have been working tirelessly to make sure that the rollout can happen. And we are working with them, and we're committed to making sure that as soon as the vaccines arrive in South Africa, we can deploy them. And for us, we obviously would want to have done it much sooner.
Sure.
But there are processes and regulatory processes to follow, and we have to make sure that if we do roll it out, we have the authority and the regulatory oversight which is needed for vaccine execution.
Do you know at this point how many doses are coming?
Well, we're going to start off with 80,000. It's 80,000 vaccines every 14 days, 7 to 14 days, and we're going to roll them out in that way because we obviously have to figure out the logistics and the supply and the cold chain, and so we don't want to bring too many vaccines in at any one time because there's a process of deployment, storage and deployment, and so we have to be nimble, and so the cargo will be shipped in every 7 to 14 days, and we will deploy the vaccine to various parts of the country. And we obviously want to try and mop up and vaccinate people in hospital, and the healthcare workers in major hospitals, and then obviously work out. It's important for us to target the Eastern Cape, the Western Cape, and Gauteng, who have been really hit hard, and then also to make sure that hospitals in KwaZulu-Natal, Free State, Northern Cape, Mpumalanga, Limpopo, and Northern Cape are also receive their fair share of vaccines. And so we're busy working on a logistic plan that will deploy the vaccine all over the country. We'll focus on 17 hospitals in the beginning, and it is our aim to try and vaccinate between 5 and 10 people a minute for 10 hours a day, 7 days a week. So that's what we're trying to do.
Thank you so much for giving us so much detail and a lot of hope this evening. Professor Glenda Gray telling us she's hoping it will be just days, no more than a week or so, before the Johnson & Johnson vaccine arrives here in South Africa. Of course, she's the CEO and president of the Medical Research Council.